And the other thing I'm seeing a lot of are guys that are coming in their 30s and 40s and sometimes even 50s that had procedures done many years ago when their hair loss was just beginning. And the surgeon who performed their procedures decided to bring their hairline down to what it was when they started losing their hair. And then they subsequently lost tremendous amount of additional hair behind where the original hairline was placed. And then you get into a problem where you don't have enough donor reserves to fill in the entire area of hair loss that currently presents. And then you're faced with options. Well, what do we do at this point? Do we try to extract the hairline that's too low via FUE and then use those follicles, recycle those follicles further back, but then you're left with tiny little dots in the hairline? Or do you just leave the hairline alone and fill in behind the existing hairline? There are options, but the best option is that things are done correctly the first time.
Yeah, and that's one of the biggest problems that we see online, on the message forum where, listen, physicians are going to absolutely present their best cases. And even the guys, the patients that are willing to come online and present their own cases, speak about their own experience, put up their own images, usually they're younger guys who have had a procedure that they're a year out, maybe they're a year and a half out, and it looks amazing, but they don't realize what's coming down the line. And sadly, all that stuff stays online in perpetuity. And guys are going out there and they're doing their research, and you're like, hey, Dr. So-and-so was able to do this with this patient. I'm in the same position. I'm 24 years old. I want my hair back. And I think that's another major problem that a lot of people don't understand. We were discussing this on the phone. I think the best thing to do is, look at a guy who's 5 years out, if possible. Look at a guy who's 10 years out, if possible. Now, obviously that's not something that you see a lot of online, but people really have to understand that it's such a major commitment, and hair loss is a progressive, you know, disease or a progressive, issue that what they are dealing with today isn't necessarily what they're going to be dealing with in 5 or 10 years. And sadly, I would say, and you can correct me if I'm wrong, at least 30 to 40% of the people that I speak with who have had surgery, aggressive surgery, done just 3 or 4 years ago, are really in a dark place now. They're very unhappy. And while there is an option to correct it in some cases, like you said, doing it right the first time is the only way to really get the head of hair you want.
Absolutely. And then just in practical terms, what's the harm in being a little bit more conservative on the first go round, especially if you're a young patient? You can always lower the hairline at a later date if you determine that the hair loss is not progressing to a severe endpoint, that you're going to have a lot of donor hair to deal with. But once you've gone too far down, then that's when you have the problem. So why not be a little bit more conservative to ensure that you don't end up with that problem?